This is going to blow your mind. Welcome back to Fitness Inc. Today, we're diving deep into the world of myofascial release, or MFR, a fascinating therapy that targets the fascia, that web of connective tissue that wraps around our muscles, bones, and organs. This therapy might be the key to releasing those knots and improving your flexibility. Let's get into how it works, its history, and the science behind it, including insights from recent research. So, what exactly is myofascial release? MFR is a type of physical therapy that targets the fascia. Now, fascia is like a thin layer of connective tissue that holds everything together. It's sort of like a net that wraps around your muscles, bones, and organs. But due to factors like injury, repetitive stress, or inflammation, the fascia can become tight and restricted. That's where MFR comes in to relax these tissues, improve blood flow, and help with pain relief. A 2019 study published in the Journal of Bodywork and Movement Therapies explains that the fascia's elasticity is crucial for muscle and joint function. Tight fascia can limit range of motion and even lead to pain and movement restrictions. MFR techniques are simple but powerful. The therapist, or even you yourself, applies gentle, sustained pressure to the fascia, stretching it gently to release restrictions. This sustained pressure helps the fascia gradually relax, relieving tension and promoting better movement. One primary goal of MFR is to release trigger points, or painful knots, which are often associated with chronic pain. Research published in Pain Medicine has shown that MFR can be effective in managing myofascial pain, especially for those suffering from conditions like fibromyalgia or chronic back pain. The roots of myofascial release go back to osteopathic medicine in the late 19th century, with Dr. Andrew Taylor Still, who emphasized the importance of the musculoskeletal system. But in the 1940s, Dr. Janet Travell and Dr. David Simons further developed the techniques we now use for MFR. They studied myofascial pain and documented trigger points, areas in the fascia that can cause referred pain patterns. Then, in the 1970s, physical therapist John F. Barnes took MFR a step further. He formalized techniques that focused on sustained pressure for fascia release, bringing MFR into the mainstream. Today, it's widely recognized and used in physical therapy, athletic training, and even self-care practices. Benefits of myofascial release. So what are the benefits? According to a recent review in the Journal of Sports Rehabilitation, myofascial release is linked to reduced pain, improved flexibility, and faster recovery in athletes and non-athletes alike. It helps improve the elasticity of the fascia and ultimately can enhance your range of motion. Let's do a quick demonstration. I'll show you some basic myofascial release techniques you can try at home, starting with the foam roller for your back and legs. Remember, always apply gentle pressure and hold each position for a few minutes, as it takes time for the fascia to respond. Now, while myofascial release is generally safe, it's important to remember that it's not for everyone. Some conditions, like fractures or certain connective tissue disorders, may not be suitable for myofascial release. According to a 2021 study in Physical Therapy Reviews, it's best to consult with a qualified therapist to see if it's right for you. I bet you didn't know how effective myofascial release can be. Myofascial release is an amazing therapy for relieving pain, improving flexibility, and promoting faster recovery. Whether you're an athlete or just looking to manage daily stress and tension, myofascial release has something to offer. Thank you for watching. If you found this helpful, please hit the like button, subscribe for more insights on health and wellness, and let me know in the comments. Have you tried myofascial release before?